Good afternoon, everyone. Welcome to our virtual conversation on a very important topic. And we have a wonderful group of panelists that you're going to hear from in a few minutes. For those of you who don't know me, I'm Rob Cashel. I'm the president and CEO here at Family and Children's Agency. We're one of the largest nonprofits here in the greater Norwalk area, and we provide a variety of different services to children and families and adults and seniors. Historically, we've always had a very important focus with the homeless here in Fairfield County, and in particular, work that we do in providing supportive housing services. So today we're going to focus on the issue of the cost of a home and the challenges of housing in our community of Fairfield County. We have a very distinguished group of panelists. I want to introduce them and then we'll get right into the questions. The first is Helen McClellan, who is the president and CEO of Homes with Hope. Helen is a true expert in the area of housing within our community. She is establishing an incredible number of housing units, affordable housing units in the community of Westport and beyond, and is a recognized leader in this area of service. Welcome, Helen.
Hi, everyone.
Also with us today is Sabrina Roman. Sabrina Roman is the Fair Housing Officer for the city of Norwalk and has a very important role in terms of investigating housing discrimination issues and is another key player when we look at this topic of today. Welcome, Sabrina. And then finally, from Family and Children's Agency, we have Alex Salazzo. Alex is our Director of Supportive Housing here at Family and Children's. She has been working in the field for well over a decade. She has a master's in social work and really focuses on the critically important issues of providing support to people who are either looking to attain housing or have attained it, and really we're looking to hopefully help them stabilize and continue in the housing. So welcome, Alex. So
Thanks,
let's
Rob.
jump right into the questions for today. Oh, and housekeeping. If you have any questions, please enter your questions in the Q&A that's available to you. We will do the best we can in the hour that we have to hit as many of those questions, and this wonderful panel, I'm sure we'll have some really important answers for you. But we're going to get us started with some questions that we know are critical to everyone. And Helen, I'm going to start with you. And one of the questions that often comes up is, what is the real cost of housing here in the greater Fairfield County area? I'm sure there's some real variations, and we're really talking about rental housing. So if you could just give us some sense of, what it really does cost for a one or two or even a three-bedroom home in this area.
Sure. Hello, everybody. Housing is a real problem right now for everybody. And just to put it in perspective, for fair market rent for a one-bedroom apartment right now is $2,172. For a three-bedroom, 3,176, and for a four-bedroom, 3,541. That's your fair market rent. But put it in perspective, Rob. Connecticut's minimum wage is $16.35, and it'll increase to $16.94 in January. That's per hour. And even with two minimum wage jobs, a person couldn't afford what it would cost to live in one of those apartments. So a family in a three-bedroom at $3,176. Using the 30% rule, a person would have to earn between $61 and $67 per hour. Pretty crazy.
Wow. Wow. That's pretty remarkable. How does this compare to previous years? Is it comparable, or is this issue of the cost, is it going up from year to year?
Um, so Connecticut's housing market is very tight with low vacancy rates, and it has risen 20 to 30% over the past 6 years. And we all know what has happened. People have moved into Connecticut, out of New York, raising the price of housing, and it has pushed the affordable housing to a new level. So there's nothing affordable available anymore, and that's what has brought us into this crisis. So 20 to 30% is a lot of money.
Yeah. Alex, let me swing over to you.
Yeah.
We we know housing is an issue in general, but we hear that affordable housing in particular. Um, what's driving this issue of a lack of affordable housing? Do you have a sense?
Yeah. So I think there's two main factors. Um, I think Fairfield County's proximity to New York City. We have strong railway and highway connections, which keep the housing demand high. These higher income buyers and renters outcompete our lower income households, which push up the prices. Um, uh, the next one, I really think there's just a loss of naturally affordable units. Um, Older, lower cost apartments and multiple family housing, they're getting renovated, they're getting converted into high-end rental units or condos. And these upgrades, I mean, we all know they're high construction and developmental costs. It's making it financially difficult for owners to build below market housing.
Mhm. Sabrina, any thoughts on your part on this question?
Yeah, so from a fair housing perspective, a combination of rising rents, low housing production, high land and construction costs, limited supportive housing stock, and discrimination. So we see that particularly against voucher holders, people with disabilities, and immigrants. All of these continue to push families into instability, and Fairfield County remains to be one of the most expensive markets in the country. So even small disruptions lead to a big crisis.
Yeah. Helen, any thoughts on this one?
Yeah, I'm agreeing with everybody here. This has become a state that it's nearly impossible to live in, and without the support of our legislators and our government to help us to advocate for the most vulnerable, we're going to continue with this crisis. So we want everybody to understand the value of affordable housing and not to be in any ways judgmental when we talk about building and having affordable housing in our communities, because we need people to be able to work in the community they live in and be a productive part of that community. And we can't do it unless we have affordable housing for people to live in.
Yeah. Sabrina, I'm struck with one of the things you said, and I'm sure it comes to your office. And you mentioned discrimination, and maybe you can talk a little bit about that from your vantage point.
Yeah, so I actually would say one of the biggest misconceptions is that supportive or affordable housing brings problems into a neighborhood. In reality, research shows quite the opposite. So, multiple national studies have found no negative impact on surrounding property values. And in some communities, supportive housing developments have actually stabilized neighborhoods with high vacancy rates. And we
Mhm.
see that locally here in Norwalk. So our own mixed income and supportive housing developments have maintained strong lease up and low turnover. That shows that families thrive when housing is stable. Another misconception is that discrimination is rare and doesn't exist, but discrimination is deeply woven into our housing system. In 2024 alone, fair housing agencies nationwide processed more than 27,000 discrimination complaints in the
Wow.
rental marketplace, which is the largest share of transactions. So
Mhm.
I think that speaks to the high number of discrimination.
Yeah. Alex, in your role, where you're looking to place people in housing,
Mhm.
do you find that issue coming up in terms of, you know, misperceptions and even discrimination?
We do. So, um, with my role, so just a little bit different. There's all different kinds of like vouchers and resources available. So which makes it a little bit, it's confusing. I think housing just generally is confusing. So your local housing authority holds the availability of housing vouchers, whether it's like a Section 8 voucher or a public housing voucher. Um, so kind of just like the differences, Section 8 vouchers allow you to rent from private landlords throughout the city, and public housing vouchers are properties owned by the city or the state. But unfortunately, housing vouchers are really, really hard to come by. They have extremely long wait lists. And when a wait list opens, it's announced throughout the whole state. So everybody can apply. And there's always usually a really short time frame to do it. Um, with with seeing with seeing the discrimination, you see landlords who may say, oh no, like I don't want to rent to anybody who has Section 8. But, and we'll go into it a little bit later, the neighbors and clients and just people in the community who have Section 8 are there are restaurant workers and they're you and me. And we're going to talk a little about that later, but um, for resources when it comes to that kind of thing. Resources happen really quickly and only for a limited amount of time. So just, I would say, keeping yourself informed on what's happening in the community is the best way to find, available resources when it comes to like those housing and the vouchers. Um, Following your city's, social media page and visiting the social service department at City Hall, calling FCA, visiting Homes with Hope, the quickest way to find our resources.
Yeah. So, we're talking about affordable housing, and Helen, I'm going to throw this to you. Um, who are we talking about? Who falls into that category of someone who might really need affordable rental housing in this community?
Well, we see for example, we opened up an 18 apartment building here in Westport that's affordable housing. We opened it up for 2 weeks, and in 2 weeks we had 380 people that applied.
Wow.
So most people had some connection. They wanted to live in Westport. They work in Westport. They wanted to stay in the town that they either grew up in or that they were working in. Many people were coming in on buses and spending a long time trying to get to work. People were working in the service industry, working in local doctors' offices, people working in the school system, working in all sorts of jobs that locally, and other people wanted to be in good school districts, which Westport is a really wonderful school district. So their kids get an opportunity to get out of poverty through a good education. And who doesn't want that? So in order to be part of any community, there has to be all levels of affordability. And the people that we see in that building are a prime example of the value that affordable housing brings to a community. And teachers can be living in affordable housing, policemen, people that work in, the fire company, all sorts of different people. So there's different levels of affordability. There's, 80%, 60%, deeply affordable. So depending on the level of jobs people have, that's where they would fit into these affordable units.
Yeah, yeah. Alex, what are you seeing relative to that question of affordability? And I know Helen did a really nice job kind of telling us who this population really includes.
Right. So we are also seeing those community responders. We are seeing the EMTs, the teachers right out of school. We want people who were born and raised in Norwalk to be able to live in Norwalk. We want the teachers who teach in Norwalk to be able to live here. And right now, it's not a possibility. There aren't enough units. Um, so we want that, sense of neighborhood. We can talk about seniors. I mean, fixed income, and there just aren't enough units. And, seniors, they want to remain in the houses that they, raise their families in, and they've built networks.
Yeah. Yeah.
That's something we see a lot, Rob, and everybody else in the shelters is people that are on fixed income, the elderly. They're being pushed out of homes into homeless shelters. Nobody belongs in a homeless shelter. Everybody belongs in housing. And if we can't, fixed income, you can't live on it anymore. You can't live on disability payments. Even with disability or fixed income and a job, you're not able to afford a home. And we also see the people that work in our nonprofits that are helping the most vulnerable, they're not able to afford a home either. And they are prime candidates to apply for affordable housing and live in the community that they work in.
Gotcha. And Sabrina, how about you? What are you seeing relative to this?
So I think it's important to also note that there are multiple pathways to housing insecurity, right? So people arrive at housing instability for many reasons, and it's rarely just one thing, as everybody said before. Here in this office, I see families who fall behind after medical emergencies, a sudden rent increase, a sudden death within the household, domestic violence, the loss of a job, racial discrimination, a denied reasonable accommodation request. Others face language barriers, credit issues, or are new to the country and unfamiliar with the housing system. In Fairfield County, high cost markets and even one of these setbacks can push your entire family toward a crisis. But it is also important to recognize that housing instability and homelessness are not just renters' issues. Homeowners can and do experience severe housing stress as well, particularly when they face foreclosure, falling behind on mortgage payments, rising property taxes, predatory lending, unexpected repairs that threaten the safety or the ability of them to live in their home. So whether someone rents or owns, the loss of stable housing has the same destabilizing impact on families and children in the community that we all live in. What I want people to understand is that housing insecurity is not a personal failure. It's the result of a structural barrier. It's a limited affordability inventory. It's income that hasn't kept up with the rising rents that we see here. And in too many cases, it's illegal discrimination. I think all of our goal here is to meet every resident with dignity and help them navigate systems safely.
Yeah. It sounds from what you're saying and the other people on the panel, it doesn't take much to tip into needing affordable housing. You could be in a very different situation and some event happens and it changes everything. I see a lot of nodding of heads. Helen, are you seeing that?
Yeah, I go to our homeless shelter quite a lot and I see people that are regular people. They just, they're going off to work every day. They might have had a medical issue that happened that they got a huge medical bill. They, all sorts of different reasons. And um, regular people, they just can't afford to live anymore in Connecticut.
Yeah. And Alex, are you seeing that as well?
Yeah, I mean, when we think about a household earning, $40 to $60,000 a year, they can't afford the typical $23,000, in rent if they have especially if they have a family. Um, I mean, the people who, like we said before, who need affordable housing, there are essential workers and they keep our community running. Like those are the social workers, those are the EMTs. And unfortunately, they're helping people all day long and then, they're struggling.
Yeah. Helen, you mentioned shelters, and a question really for all of you. If you could just kind of share, I assume we have a network of shelters um, from probably Stanford right up through Bridgeport and beyond. Um, is there even enough space in those shelters? when that becomes the emergency need right away. Helen, why don't I start with you because you run a shelter?
So shelters are at pure capacity. Every time that somebody exits a shelter, immediately that exit is put into a homeless management information system where when people are homeless, they call 211 and people are prioritized into shelter. But unfortunately, shelter beds, there's not enough. There's, I think yesterday it was something like 167 people that was on the shelter wait list. That's just Fairfield County.
Mhm.
And this is data from the HMIS Homeless Management Information System. In 2025 alone, there was 15,799 calls to 211. Those are people looking for homeless shelter, low-cost housing, or rental assistance in Fairfield County region alone. That's a crazy number. And from 2024 to 25, the statewide annual point in time count showed nearly 10% increase in people experiencing homelessness and a 45% increase in unsheltered homelessness. And I could go on and on with data on things that showing the increase in the need for affordable housing.
A question for you all. Why is this need becoming so dramatic as time goes on? What do you think is really driving this issue? More and more people who are homeless.
We talked about it already. What's causing it is the price of housing and the lack of housing and the lack of government funding to support some people and the price of the amount of money people are earning in jobs. They're not earning enough to live, and then they're falling into a system that they are not able to dig themselves out of. And that's what's very frustrating to all our staffs in all our agencies. They're dealing with huge amount of people that they need to help them with all sorts of different things. But what we're lucky is that we have very qualified staff in all our agencies and partnerships. It's all about partnerships because every client that comes into any of our agencies, we can't do it alone. We need the support of the mental health professionals, the medical professional, all we all us are referring to each other and helping each other, and each client service plan has about probably 10 providers that are trying to support them to move on to self-sufficiency.
Absolutely.
Yeah.
So I'm aware that there is a good deal of coordination that takes place here in Fairfield County, maybe different than a lot of other parts of the country and maybe even parts of the state. Can you all talk a little bit about what that is? Because I know we have a coordinating group that looks to really come together and respond when this issue comes up.
I can start.
Go for it.
So the state of Connecticut uses a coordinated statewide approach, which means wherever you live in the state, everyone is communicating the same. So we have in this, coordinated network, we call it diversion. So we talked a lot about shelter and, what that looks like and who are the people that are actually there. So diversion strategies, they run through calling 211. They are very much followed by your local nonprofits. So FCA, Open Door Shelter, Homes with Hope. You can actually, even instead of calling 211, Homes with Help has the Greater Norwalk Hub where you can actually walk in and talk to somebody about what the issues are and talk about these strategies. And the people that work there, they're angels. You're seeing so much, and you just want that comfort and somebody to listen to you. And having that hub is just it's amazing. So with with diversion because we really, this is something that we really, really try to do in the state of Connecticut. Um, we we think of diversion as a strategy really before someone even enters the shelter system. So, diversion focuses on problem-solving conversations, immediate financial help, supportive interventions. The goal is to keep individuals and families housed or safely doubled up. Um, we don't want anybody to have to enter this homelessness system. So let's put these things into place so we could do what's important and see what's happening now and find solutions. Um, I think it's really important to note that the state of Connecticut prioritizes these strategies in diversion. Shelter stays are avoided really whenever possible, but diversion isn't turning people away. It's providing targeted solutions that will revolve and resolve crisis.
Mhm. Other thoughts, Helen,
We
Sabrina?
we have a system here in Connecticut, Opening Doors, Fairfield County, here in the Fairfield County area. And that's a network of providers that we're all involved with. And I co-chair Opening Doors Fairfield County now. But I found it's just such a wonderful thing that it's all about collaboration. It's all about who can do what to support each other and to support the people that we serve. And I personally, coming into the job that I'm in during COVID, the support of that network where we all got together at 8 o'clock every morning and talked and figured out what we do with the most vulnerable. Having systems like that is very important where, you know, we call you, as was mentioned, we call 211 because of the huge amount of people calling 211, we had to put those hubs in place. And the Commissioner of Housing for the state of Connecticut is the woman that helped put that in place and to fund it. So we have great leadership in our state. We also have Department of Mental Health and Addiction Services and many other funders that support this work with the Department of Housing. And we also have a system, the Connecticut Coalition to End Homelessness, which also advocates and helps prioritize the funding that we will need and the legislative asks.
Yeah.
Oh, I can speak from it from a fair housing perspective. So as we all know, vulnerable populations are just face higher rates of housing discrimination, and instability. And that's not a theory. You know, in 2024, retaliation complaints more than doubled, which tell us that when people do speak up, they face punishments for asserting their right. And there are many services to support these populations here in Connecticut. So for fair housing enforcement, there are multiple agencies like the Norwalk Fair Housing Agency, which I work for, CHRO, which is the Connecticut Commission on Human Rights and Opportunities, as well as Connecticut Fair Housing Center on a state level. There are all the prevention and diversion services that we discussed a little bit ago. There's legal helps for tenants facing discrimination or eviction. Domestic violence shelters and rapid rehousing programs are really, really great resources. Eviction prevention mediations. And one of the most important to me is the disability related supports, which include reasonable accommodation advocacy and referrals for behavioral health development and healthcare services. I think that the most powerful resource we have in this state is the collaboration that we're all talking about. When city departments, nonprofits, schools, healthcare providers, and housing partners work together, families get help faster, and that's what's important, and with dignity. So no one should fall behind the cracks just because they don't know where to turn to.
You know, talking about the different populations that really are looking for affordable housing, and one of the areas, and I want to just return to it, is with the growing aging population. How big an issue is that becoming for our senior citizens here, who probably in many cases are on fixed incomes? Um, this issue, how is this affecting our seniors?
It's very sad to see seniors arriving at shelter and to see housing lists, having long lists of seniors that can't get in. And I know all our partners at housing authorities put set-asides for elderly, but there's not enough. There needs to be more elderly housing. There needs to be more set-asides at senior living for people to get into senior living and be able to afford to be there. It's This is a system that's really broken for the people that have worked hard all their life and worked to save a little bit of money, and it's no good to them. They can't live on it. So that's what, when we talk as shelter providers about what are we seeing most at shelters, we're seeing the elderly on fixed income, even working and fixed income, and they still can't get out to get an affordable unit.
We see it a lot here at FCA. I actually share an office with the senior service manager. So working in that with that department, we have seniors just knocking on the door all the time, and they're coming in and they're upset and they don't know what to do. They either took a bus or walked to FCA. They come with a notice either that says the rent is rising and they don't know how they're going to afford it because of the fixed income. And I mean, when we talk about partnerships, like, yeah, I can walk them down to, Helen at the hub and put, these resources in place. But it's what we're seeing more and more. And unfortunately, I mean, these wait lists for senior housing, like public housing, like I talked about, it's 18 months at the minimum until we can get somebody housed. So it's a really, really difficult thing we're dealing with right now.
Sabrina, are you finding people coming into your office, seniors who are very vulnerable and are also concerned about how they're being treated?
Yeah, so I think specifically here in Norwalk, we see that around 40 to 50, or a majority of the population is spending about 40 to 50% of their income on housing alone, right? And that is exasperated for seniors who, a lot of times, the ones that are walking into my office are voucher holders. So I think that my job here is to protect the residents' civil rights. And a lot of the discrimination complaints I am seeing specifically from our senior population are going to be those reasonable accommodation requests and the just truly a misunderstanding between the landlord and a lot of times the agencies that are providing the support about what is considered a reasonable accommodation and how reasonable accommodation and modification should be requested in and how they should be responded to as well. And that's something that our office does a lot of training around for agencies. Specifically, we'll have hour-long training just on those reasonable accommodations to assist those elderly population.
Yeah. Yeah. Interesting. So, one of the things, of course, that we like to do in these virtual conversations is have some opportunity to really talk about what can we all do to address what seems to be an intractable issue with all the different elements. And Helen, I'm going to start with you because you've truly been a pioneer in your community in developing units of affordable housing. I guess my question to you is, how have you done it?
I think the biggest way that we can all work together is by listening to see where there might be money available and figuring out how you can fit that money into a need. And at the time that, say, for example, the 122 Wilton Road apartments came available to us, the Commissioner of Housing was telling all the nonprofit leaders and developers that there's a huge shortage of housing, and anything you can do in your neighborhoods to find more housing and build and rehab, we will support you. So at the time, that's what I did. I listened and I advocated for affordable housing in the area. I think everybody can do a little, whether you're involved in nonprofit, you're a part of every community. Everybody lives in a community, and everybody can do a little bit. And I think the legislators have a lot of clout. And get to know your legislators, write them a letter, meet them, have a cup of coffee with them, tell them why you voted for them, tell them what means a lot to you, and if housing should mean a lot to everybody, because everybody needs a house. So talk to your legislators, go to the lobbying building, go to their offices, talk to your state reps, and tell them how important it is. Talk to them now about what's happening with HUD funding. With if this happens and the continuum of care program is disabled, which serves 9,000 individuals in Connecticut, we're in a major crisis. So talk to them about what you're hearing on the news. And they are parts of our community, and they go to the governor and the commissioners, and they will help lobby for us, because that's what we need, more housing, and they can help us.
Alex, Sabrina, any thoughts on this one?
I do. So, gosh, that was great, Helen. So when I think about the question, I kind of think about it as, the community member and maybe the person who's logging on to this virtual conversation, the mom, what being a strong advocate, right? That's what Helen was talking about. Like, just say what's on your mind and talk about what you believe in. Um, yes, I mean, voting for zoning reform, like, yeah, that would really help. But kind of like on a nonprofit level, and what we look for, and working, with those frontline workers, the people who are trying to keep people in their homes, right? We want to prevent all of this. We want to keep people in their homes. So, um, like, donations are like they're essential, and not only during the holiday season, which is a point to definitely make. Many of our programs are grant funded, like Helen said. Um, our funds, they're regulated, and having some kind of unrestricted client fund would go such a long way in assisting the community. For example, pretty much, if you think about it, every single employment application is online, right? That's how you apply for jobs. Um, if my staff is able to purchase a laptop for a client, with like a non-restricted client fund, the client could apply for jobs, the comfort of her own home while their kids are sleeping. Like, those are the things that make an impact.
Absolutely. Sabrina, any thoughts on this one?
Yes, I do. I feel like you both have motivated my answer from what I previously was thinking. So I think it is really important to say that cuts to federal fair housing enforcements have already led to fewer complaint investigations and even closures of local fair housing organizations across the country. Reducing these protections does not reduce discrimination, it only reduces accountability. So it puts seniors, disabled residents, and families with children at greater risk. There is a war right now waged against housing stability for our most vulnerable neighbors, and our job together is to push back with policy resources and solidarity so that everyone in Fairfield County has a real chance to stay housed and thrive. Everyone who is on here listening has a role to play. So individuals themselves can learn about fair housing rights on the Norwalk Fair Housing Instagram, website, LinkedIn page, and I challenge you to challenge the myths when you hear them, and use your voice with local and state decision makers to support affordable housing, tenant protections, and funding for fair housing enforcement. People can volunteer with organizations like FCA and Homes for Hope, and local fair housing agencies and legal aid groups. So whether that's mentoring families, supporting food and basic need programs, or helping with outreach events, donors and civic leaders can go a step further. by making funding by funding prevention services and serving on boards and commission like Alex does, and using networks to lift up accurate information, which is very important about who actually benefits and needs affordable and supportive housing and why it benefits the entire community.
Yeah,
Brilliant.
that's great. That's great, Sabrina. And you hit the perfect answer for one of the questions that came in from one of our audience people. And another one that came in recently that our audience is asking is the impact, because we've talked about the challenges of not enough affordable housing, misconceptions that lead people probably to views that are just not accurate. But given what's happening at the national level, how concerned are each of you relative to national policies that may have an effect right here in Fairfield County? Big question.
I'm happy to go first with that one. I'm very concerned, as are all the CEOs in positions in nonprofit. We have a system that was working well, and to dismantle things is very difficult for us all. As I mentioned before, the Continuum of Care funding serves 9,000 individuals in Connecticut. This COC program is the backbone of the national response to homelessness. Funding permanent supportive housing and rapid rehousing is crucial. If the Continuum of Care funding is cut, 2,285 households will lose their housing in the Fairfield County region. And just putting that into perspective, that's 2,548 people in permanent supportive housing and 622 people in rapid rehousing. You know what's going to happen. They're going to end up on a bigger list than there is already for services and support. So this is the time for people to rally, to advocate. And as my colleagues here said, be out there. And I just have one ask for everybody. On the 12th of December at noon at 10 o'clock in the morning at Greens Farms Church, Opening Doors, Fairfield County, and the Connecticut Coalition to End Homelessness are hosting an event for all legislators in Fairfield County, and we'll all be there. And that's an open forum for all the neighbours, for everybody in Fairfield County to come to and hear what's going on with the funding and to hear how they can help, because everybody can help.
Yeah, good. Good to know, and for everyone who can participate, really important. Alex, Sabrina, concerns relative to what's happening at the national level?
Yeah, I mean, we're very concerned. In the social work field, we really, we try to take things day by day. Things change very quickly and very often. But this is scary. Our neighbors are scared, our clients are scared, our tenants are scared. People watch the news. But kind of like throwing it maybe a little bit to a positive note, the state of Connecticut, is really, really trying. And on a state level, this past week, actually, they passed the Connecticut Housing Bill 8002. And that bill, it aims to address the state's severe housing shortage, and streamlining like development process and encouraging new housing units. So really the state is looking to build more housing units next to railroads and bus stops, so people can utilize them. People could utilize, having to go into the city, trying to rebuild those vacant, commercial spaces. I think that's something to hopefully look forward to kind of, have a little bit of hope.
Yeah, absolutely. Sabrina?
I think I can just mimic what everyone has already said. It is extremely scary times right now, and I can strictly speak to a fair housing perspective on this, and the truth is that regulations being rolled back is just creating a breathing ground for discrimination to become normalized again. I'm seeing it more blatantly than ever before. I'm seeing it more often than ever before. And the truth is that it's going to put a huge strain on all of our systems. That means that people are going to be treated with less dignity, with less respect, and it's going to put the residents that we care so much for in a mode of defense. So we all have to, as an agency, be ready to do what we can to fight alongside them with the resources that we have.
Yeah. Question that came in from our audience and was interested in each of you commenting, the issue of housing instability, which is obviously a huge part of what today is about. Your thoughts on how it impacts both mental and physical health individually and within a community. So how do you see that was the audience question. How does housing affect those other parts of people's lives?
Well, that's a great question, and it's the answer is it affects everybody's life. If you don't have a home, you're going to have situational depression. You're going to have situational things to work out. It's not a situation that anybody plans to be in. And I always say I've been working in the homeless system for a few decades now, and I never met a person yet that wanted to be homeless. And this situation, getting into homelessness, is something that it takes a lot of providers to help people get out of. Yeah. And back to the judging, please, anybody that's out there that can help take away the stigma of judging people. Everybody that ends up in a situation like this doesn't want to be in it. And they are going to end up with problems, whether it's the children through, Rob, you know best, with all the children that you take care of with in FCA, how homelessness and poverty and lack of housing and even the threat of becoming homeless, not alone homelessness, the threat of becoming homelessness, why prevention is so important right now, as was mentioned. But that's my answer to it. I think that, this is a really big problem, that when you become homeless, everything trickles down and you can't get out. It's hard to get out of the situation.
Yeah. Yeah. Alex, I see you nodding your head.
Yeah. So throughout Fairfield County, throughout the ODFC, we work, especially here at FCA, on a housing first model. So how can you work on anything else if you don't have a roof over your head? Yep. How is that doable? So here at FCA, Helen just mentioned a little bit about prevention, right? We want to prevent all this from happening. FCA plays a really, really large role in prevention in our community, as well as Homes with Hope. If members of the community are able to take advantage of the resources that are available, it could just avoid crisis in general. So sometimes just speaking with someone who is knowledgeable on the topic could just prevent stress and anxiety. There's an opportunity at FCA to be involved in outreach services, which can help prevent a crisis. A case manager can help you enroll in programs like renter's rebate and energy assistance, and even knowing the locations of local food distributions. Those can really be long-term solutions.
Yeah. Sabrina, in your role, are you seeing people coming your way and they really have some real behavioral or even health issues that relate to what's going on with their housing?
Absolutely. I see more than not in this particular role that disability is like one of the biggest forms of discrimination. So like a physical disability, a mental disability, sometimes it's not a disability, it's like neurological differences in communication. truly are impacting the way that people are being treated. Um, that is speaking about the adults in the situation. Who I see here are primarily adults. That's who I'm speaking with, and that's who I am assisting. However, fair housing and housing instability affects children in the home as well. So, to Alex and Helen's point, if this is going to be a generational issue, so helping housing instability doesn't only help the now, it helps impact and form the child's future as well. How can a child sit in a classroom and focus if their parents had to figure out, am I going to pay rent or am I going to pay for a meal for them? That impacts the way that that child learns, that impacts the way that that child's grades go and how they maneuver in life and how they see themselves and their self-esteem. So I do believe that fair housing and housing instability, we're seeing it impact not only the adult community that we have, but also the children that are going to hopefully grow and stay in Norwalk. So it's just creating those supportive housings for the whole household and not just thinking about it as an individual adult issue.
Yeah. So a question that came in from, again, one of our audience, and we could probably put these two questions together. If you all could elaborate on how someone, and you've already spoken about this, but how someone might enter the system that you've talked about and how they might avail the resources that they need, and then how, which is all part of this, do the agencies work together? How is this something? So I think what the listener's probably looking for is a little more information on how that all happens.
You want me to
Yeah,
begin?
Helen, we can, yeah, both do it. Yeah, you can start.
So I think if somebody is homeless, we talked a little bit about this before. If they're homeless in Connecticut right now, you call 211. That's your entry point. And the goal of everybody is to prevent people from hitting the shelter system. That's the last place you want to end up. If we can get people prevented, diverted, that's the way to go. Because of the lines of people, the length of time it took to get a worker at 211 based on the need, that's where the hubs came into place throughout the Connecticut, and we have hubs here in Fairfield County as well. So people can walk into their hubs, their local areas, and get support. And what those workers will do, the first thing they try to do is find out, have they got some income? Can they get help with preventing a homeless episode? And that's where some money comes from the Department of Housing to help with prevention dollars. But there's all different money for different things within the system, but it all starts with that first phone call to 211 or walk into a hub. And Alex, I'll move it over to you to talk a little bit about the system.
Yes. So kind of like we talked about before with diversion, the strategies that come into place, right? We want to prevent and resolve the crisis. So I mean, meeting with kind of before we talked about the workers at the hub who are literally going to sit you down and they're going to say, this is what we need to do. Because in that moment, I could only imagine what that person is feeling, right? They are probably really, really scared. Um, so I think with making a safety plan, right? So that worker is going to say, what can we do and what can we do to make sure you're safe and you have somewhere to stay? And if not, then we need to put you on a shelter wait list. Okay. So they will go through all of those, what is available and what's the best option for you and your family. Again, we're going to try to prevent shelter because what if you have a family of 4? Are you going to be split up? So we're going to take all of that into account. And then if you have to go into shelter, then while you're in shelter, you work with case managers and social workers to try to get you, somewhere really, really safe to live. And there's wonderful, wonderful support in shelters where hopefully your stay isn't long and we can figure out a way to get a roof under, over your head. And that's really where we start.
Great. So we just have literally a few minutes before we have to wrap up. And I want to thank all of you for uh, your very important information today. And that's what we hope to have happen with these virtual conversations. A lot of education and maybe breaking down misconceptions that are part of the issue here. But let me end with a question, and I'm going to ask each of you to just state one thing, because we've gotten a lot of people who are listeners who are asking, "Hey, what can I do?" So, if you were to think of one thing that our listeners could do to help address what I think you would all agree is a real crisis within our communities. So, Sabrina, I'm going to start with you. What is one piece of advice you might give to our listeners?
The short and brief answer is going to be collect resources. Collect, nobody's expecting any agency, any individual to know everything about housing instability or every resource that Connecticut has. So just knowing that you can turn to this panel, just knowing that you can go on the Fair Housing website and see reasonable accommodation letter generators, knowing where to point someone to can be all the difference. So I think that's the biggest thing that we can do. So the more that we collaborate, the stronger and more equitable Fairfield County becomes.
Terrific. Terrific. And Helen, how about you?
I think you know my answer, advocacy.
Yeah,
Come to the event on December 12th at Greens Farms Church and get involved with advocacy in your local community and know who's on your P&Z and tell them how much housing means to you and to the people that you know in the community.
terrific. And Alex?
There's no such thing as small change. So be willing to learn about the struggles that are happening in your own backyard. People already are logged on to this. They want to know. They have the questions. Be that advocate, and make the small change.
Terrific. Wonderful. Well, listen, thank you again, all three of you, Sabrina, Alex, Helen. This has been a wealth of information. And we will have resources, as we always do, that will go out to the people who signed up for this virtual conversation. I think each of your pieces of advice are important. I know Helen has already mentioned this program that Homes with Hope is co-sponsoring in December. So get involved. I think that is probably a huge part of the message that you are all saying, because this affects our community and people who are our neighbors. So, so thank you all. And thank you for those of you who have tuned in to today's. Stay tuned. We will have another virtual conversation in a few months on another topic that I think is important for all of us to focus on. So thank you.
Thank you all.
Thanks,
Thank you all.
everyone.